Vista Middle School. Good afternoon, Bella Vista. This is Mary.
Hi, Mary. Could I speak to the school nurse?
Health office, Bonnie speaking.
Hi, Bonnie. My daughter just gave me a flyer about a vaccination for whooping cough. She's telling me she's not going to be able to go to school there next year if she doesn't get vaccinated.
It's a state requirement for a booster shot at the Tdap.
Okay. She has to have it, or, not really keen on these vaccines right now.
Well, whooping cough is it's out there, and it's been a state requirement since last year that everyone entering 7th grade should have it. And it's not necessarily the severity of it depends on sometimes the age of the person that gets it. Sometimes the older ones are okay, but if you have infants in the house, it can be fatal to them if they get whooping cough. If you choose not to get it, you just need to come in and sign a waiver.
Oh, so I can sign a waiver?
Mm-hmm. But if you have infants in the house, I would really talk to your physician about it before you sign a waiver.
Okay, well, I did not know that.
It's others in the community, too. It's just not those that you have in your house. But it's completely up to you. Okay. So you just need to come in and sign the waiver.
All right.
Okay.
Well, you know what? Do you know why they don't put that on this flyer? Because I was kind of getting stressed out.
Well, because we aren't encouraging you to do waivers.
Oh, you don't want us to?
No, because that's how the disease doesn't spread. The more people that are immunized. It's a contagious disease, so.
Yeah, okay.
Okay?
All right, well, I thank you for your help, and I will swing by and pick.
You have to sign the waiver here. Just come in and sign it.
Okay, there's nothing I can get online?
No, you have to come in and sign it.
All righty then. I appreciate all your help. Thank you.
Yep, you're welcome. Bye-bye.
Hello, this is Tom Herman.
I've been doing a lot of research here, and everything I've come across, it seems, the state of California, whether it's Department of Public Health or the California Department of Education, they really seem intent on having everyone vaccinated. It's gone to the point where they've even told me to my face that they don't want us to know that we have options. And I'm kind of concerned. I don't understand what seems to be such the rush to get everyone vaccinated and then, not let them, be informed.
And yes, it's true. It's not really advertised in the same way as the vaccines are advertised because it doesn't work that way. It's kind of like, you could do the same thing with testing. Say, I don't want my son or daughter to take the STAR test or something. That you can also opt out of that, but no one advertises that because then, we have to test kids. But
well, I didn't know that either, though.
Requires all 7th through 12th graders get vaccinated for pertussis, more commonly known as whooping cough. Students will now have to show proof they got the booster shot.
No proof, no school. I repeat, no proof, no school.
Listen to our government agencies. These guys are telling the truth.
Time. Forget the conspiracy. Listen to our government agencies. These guys are telling the truth. There's no conspiracy here, folks. Just get your damn vaccine.
Do you know that these vaccines, neither one of the two that you use in the state of California have been tested for carcinogens or how it affects sterility or how it affects the fetus. But yet, even on your own websites, there's plenty of advertising there that says pregnant moms should be getting vaccinated. And then all these side effects, and they're severe. They admit now in the inserts that come with the vaccines, they say that there's a slight relationship between these vaccines and Guillain-Barré, convulsions, brain swelling, paralysis. I don't know. Would you give your child this vaccine to prevent something that can be cured? And you don't know this, and this is your training because this is how you're trained. it's a 2-week round of erythromycin can cure whooping cough or take the vaccine. I mean, how would you?
It can if it's caught in time. You're right, but students do have, and families have, of course, rights. They can have an exemption.
But so you think that it's acceptable that you guys are deceiving people? Like when you don't give them the whole information on a flyer, it's the shot or no school. You're saying that you condone that behavior so people will get the vaccine? I mean, I'm really concerned here. This is a practice that I'm not very. I would not encourage in my children. I know the schools don't encourage my children to behave this way. So I don't understand why it's being allowed to on this level.
Well, I don't know exactly what flyers you're referring to, but
they're the same ones that we just talked about. They're all over the internet. Either you get your vaccine or you can't go to school. And then on really small print on some of the flyers, you can get a personal belief exemption form. And then when I tried to get it, they wouldn't send it home. They wouldn't tell me I could get it online. I had to come into the school and sign it. They would not let my daughter bring it home. And it was like very inconvenient.
Sure. Well, yeah, different districts can do that the way they're not required to do it a certain way with a certain form or whatever. I don't know about them have you come in. I mean, it seems like something serious enough that they would probably want to make sure that someone else isn't writing the form or something. So I guess I can understand that in part. But
I don't know. I don't know, Tom. I just don't think it's right for you guys to leave out some very critical information and then threaten people with no education. I just don't understand that.
Microsoft founder Bill Gates has committed over $10 billion over the next decade to deliver vaccines to the world's poorest countries. Gates made the pledge while speaking at the World Economic Forum in Switzerland, saying that this year needs to be the decade of vaccines. He said the commitment more than doubled the $4.5 billion his charity foundation has already given to vaccine research already.
Sweden being a great example of a generous donor. So at this milestone, we're essentially redoubling our commitment. Over this last decade, we've spent $4.5 billion on vaccine research and delivery. And today we're announcing a commitment over this next decade, which we think of as a decade of vaccines having incredible impact. We're announcing that we'll spend over $10 billion on vaccines. That will help invent new vaccines. That will help get some new vaccines out. That will help increase the coverage.
So there's important.
It's been constantly going up. It's only various economic changes that have even flattened it at all. So we have to go from rapidly rising to falling and falling all the way to zero. This equation has 4 factors, a little bit of multiplication. So you've got a thing on the left, CO2, that you want to get to zero. And that's going to be based on the number of people, the services each person's using on average, the energy on average for each service, and the CO2 being put out per unit of energy. So let's look at each one of these and see how we can get this down to zero. Probably one of these numbers is going to have to get pretty near to zero. That's back from high school algebra. But let's take a look. First, we've got population. The world today has 6.8 billion people. That's headed up to about 9 billion. Now, if we do a really great job on new vaccines, health care, reproductive health services, we could lower that by perhaps 10 or 15%. But there we see an increase of about 1.3.
It's not really advertised in the same way as the vaccines are advertised.